Hello, Lita Danbury. This is Julie Emiliano, as you might know, and I'm here with Ashley Knapp. She's for Infusion, and today we're going to talk about health and what infusion and how you can find more information about infusion. So, Ashley, welcome to our podcast. So let's talk about a little bit of yourself, the information that you're going to provide us, and what infusion, because I know already I know about infusions, but I bet you that all of you will know, and we would like to know more about infusion. So Ashley, what is infusion?
Yeah, absolutely. So I'm the co-founder of Local Infusion. I co-founded this company with our CEO, Woody Baum, and I started out in this industry as an infusion nurse. I've been doing this for about 13 years, and I'm very passionate about patients that are receiving these types of treatment. So our mission at Local Infusion is to transform the infusion industry because we feel that patients deserve better. And Local Infusion is just that. What an infusion is, in very simple terms, it's a medication that's put into a bag, an IV bag, and it's delivered through a vein. Okay. So when you go to the doctor, when you go to the hospital, and you get an IV and they hang a drip, it oftentimes contains a medication, and that's what we administer in our centers.
Okay, so let me see if I understand. Infusion is an organization, a company, right, that provides services to what specific people? Like me, you said infusion, and I'm thinking about vitamin infusion, right?
Yes.
I'm thinking about all type of infusion, beauty infusion. I mean, and as an organization, what is your field? What specific people can reach out to infusion, and how they can reach out to you? Because as for many of you that don't know, Ashley will be on a health fair that will be on July 17 here in Danbury. So come around 358 Main Street and we will give you more information. But otherwise, Ashley will tell you more about infusion. So if I want to know about infusion, I mean, like I said, I'm thinking about beauty, I'm thinking about vitamins. So in general, infusion, what covers?
Yes, and that is one type of infusion, and we have a lot of patients that do reach out and ask about the wellness infusions, hydration, things like that. What we do is we administer drugs for patients with autoimmune conditions. So generally what will happen is a patient gets diagnosed with potentially an autoimmune condition like Crohn's disease, ulcerative colitis. Those are some of the gastroenterology conditions we treat. There's also multiple sclerosis, which is diagnosed by a neurologist. Those diseases all have these drugs that are delivered through an IV to control their disease progression. So those are the types of patients that we treat in our centers at Local Infusion. We also do a lot of injections. There are a lot of drugs that are coming out on the market that are either delivered intravenously at a center like ours or via an injection. And there's just more and more every day. We're adding new drugs to our offering. They can all be found on our website at mylocalinfusion.com if you are interested in looking over our list of offerings to see if it's something that we are administering. There's a cardiology injection for high cholesterol. A lot of people are starting to take that. It's called Leqvio. We administer that in our office.
Okay.
Also, patients that are on it's called IVIG. It's for immune deficiencies and many other conditions, neurological conditions. We can do that in our office. And one thing that patients may not understand is that they may be going to a hospital to get these treatments. And we'll talk about that, I think, a little bit later. Yes. But, we can do all of those things in the office in a private room. It's 2 to 3 times cheaper than going to the hospital and much more convenient for patients.
Okay. So you just mentioned that people need to have a specific condition. Do doctors know how to refer, or do patients need to know this information? Which one knows better? I mean, the patient obviously don't know about infusion. How do they get the information from you? Is it from the doctor, from the insurance? How do I get to know about infusion?
Absolutely. So we do partner very closely with insurance companies. For example, one of the largest companies in the country, Anthem, is a good partner of ours, and they're focused on giving their patients better experience at a lower cost for infusion treatments. So we have partnered with them, and I know that they do let their members know about local infusion, but it's really going to start with that conversation with the patient and their provider.
Okay.
What patients don't realize is that they have a choice where they go when they receive their treatment. So a lot of times the provider may just be used to, sending the patient to the hospital because they're a part of the health system and that's all that they know. So I encourage patients to really, ask their provider and advocate for themselves and say, I'm interested in going to an outpatient facility like local infusion, and I will, give you their information and we can go ahead and help the provider coordinate that.
Okay, perfect. So this is not a walk-in service. This is, it has
correct.
to have a referral from your doctor.
Yes.
Okay. Once I do that, like I already talked to my doctor, I want to go get infusion. What is the what can a patient expect from infusion? Once I step into your premises, what will be my experience if you can describe it for me?
Absolutely. And what really makes local infusion different is the experience that the patients have, because a lot of times when they go to a hospital or another setting, they don't hear back from the office that they're trying to get in touch with. They're not sure about the next steps. So if they have a conversation with their doctor and they decide they're going to be put on an infusion treatment, or if you're already on an infusion treatment, we have no problem switching you to our center as well. In fact, we've worked with Anthem very closely, and they have a process in place that makes it very easy for us to switch an authorization to our center. Okay. So the provider would send us the order. Now, if the patient, if you're interested in coming to local infusion and you're just not sure where to start, just give us a call or a text.
Okay. And how do I get in touch by phone? Because I know that you mentioned your website.
Yes.
If I'm not mistaken, is www.mylocalinfusion.com, right?
Correct. Yes.
Perfect. And if I want, but some people like to get in touch by phone, by text. What number can they reach? Or even if I want to go into your premises, what would be the address, or specifically should I call first? What's the process?
Yeah, absolutely. So our website has all of our locations listed. In Connecticut, currently we have an office in New Haven, West Hartford, and Rocky Hill. We will be expanding throughout the state more within the next year. So the easiest way to get in touch with us is just to call that New Haven office. No matter what location you want to go to, the receptionist at the office will put you in touch. We'll take care of it. So if you give us a call, the number is 203-941-5429.
Okay, hold on. Let me see. 203-941-5429.
Yes.
Right? And that's the number in New Haven.
That's the New Haven office, but we can filter everything for Connecticut through there. If a patient has a question, if they want to get started, just give us a call.
Okay.
They can also text us on that number.
Oh,
so
okay.
When we talk about the experience and what to expect, the patient reaches out. We are committed to getting back to them right away.
Perfect.
We will work with their provider to get the order. So if the patient says, I want to come to local infusion, I just don't really know how to get this process started, do not worry. That's what we're here for.
Okay.
So we reach out to their provider. We obtain the order, all of the clinical records. Like I said, we'll switch the authorization or start the authorization. We do all of that work so the provider doesn't even have to do that part. Once we get the patient approved and ready to schedule, we put them on the schedule, and on average, we're getting patients in for their treatments within 6 days of us receiving the order. Now, that probably doesn't resonate if you're not sure how this process typically works,
so,
but
yeah.
we have patients that have been waiting for 3 months to get on treatment.
3 months?
At
and
hospitals.
You cut the time into
We can schedule them on average. Our average is 6 days, and that's average. So sometimes we turn around patients within a day or two.
Well, let's repeat this. From people who get service, infusion services at the hospital, they usually tend to get 3 months. They could be either,
3
but
months
in
or
average,
more.
could be 3 months.
Yes.
And you guys can cut that time off down to 6 days.
Yes. Yes.
Okay.
And then also, we're communicating with the patient and their doctor that sent that referral from the time we received the order. So we're reaching out to the patient within 2 hours of receiving the order via text, letting them know, we got your order, these are the next steps, so that they know what to expect. And that's one thing that makes us different, is the communication.
Okay. No, so far there's a huge difference on the time and on the service so far. But tell me a little bit of the insurance. Do you guys take private insurance, public insurance? I mean, what type of insurance do you take?
Yes.
And what's the process with the insurance? I know that you take care of the whole process, but regardless of the insurance, do you guys cover the whole? You circle out like from the beginning to the end?
Yes. So we get the patient's insurance information. We do take all of the major commercial payers and then also Medicare currently. We're also in the process of taking Husky as well. Okay. So that's in the works. But we do everything. So we get their insurance information. The first thing we're going to do is look at their benefits. Okay. Now with our treatments, we also do copay assistance, financial counseling. So majority of patients don't have an out-of-pocket. Okay. And especially if they have certain Anthem plans that are the zero deductible, if they come to us, they're not going to have any out-of-pocket. Okay. But we do all of that up front. We let them know these are your benefits. These are the copay assistance programs available. Now, at the hospital, that's not always happening. I've had many stories of patients that have gotten to their, infusion appointment, and 6 months later, they get a bill for hundreds of thousands of dollars from the hospital, because there's just not that piece. The hospital's not focused just on infusion. They're doing so many other things.
But at this time, you're not working with Husky, which is the state, the Connecticut state insurance. So, right. But it's in the process.
It's in the process.
Okay,
yes.
Perfect.
So we will be.
So it will be.
Yes.
So keep in touch. It will be. So
yes.
You promise, and then now you will have to come back and let us know when.
Absolutely.
If you get any update,
yes.
when you guys will be taking Husky. So
yeah,
she said it.
Yes. and Anthem, like I said, we have a very streamlined process that we work with them. So if the patient already has an existing authorization, they've made it very easy for us to just transition that to us. And then the patient comes in and has a great experience. And like I said, what makes us different is we have private exam rooms at our centers. I'll share a video, and of course, if you are more interested, look on our website and you can see pictures of our actual centers. But they look like a med spa, but you're receiving your medical treatment to manage this autoimmune condition. And what I hear from patients is, I want to come back. I can't believe that this is so nice. I can't believe I get to have my infusion here, compared to the hospital where I was sitting in a room with 20 other people, people that may be sick, people that may be immunocompromised. We have a private room. They have a chair for their family member.
More private, more personalized,
yes.
more like into your own personal needs. Okay, I get that. But sounds very, interesting. But at the same time, I know that sometimes people face issues. What issues can people face regarding the infusions and the insurance? Because you guys work directly with insurance. What type of conditions or situations can a patient face with the insurance?
Yes. So, sometimes insurance companies do require a patient to try and fail multiple different drugs before they will allow the one perhaps that their doctor prescribed them. So that is one of our biggest challenges. But we do, like I said, have great relationships with the insurance companies. So I would say 90% of the time we can get things pushed through and approved for the patient. There's a lot of times that we'll have to appeal authorization, denials, and things of that nature. But we handle all of that so that the patient and the provider does not have to.
Okay. That sounds, very interesting. And I want to know more. Can you share any great outcomes or stories that you might be aware of? Because now I want to keep in touch with you. I want to keep in touch with you. I want to know more about infusions. But if you can share any positive outcome that you might be aware of infusions, or any something that you can tell so people can engage and see why infusion is a great treatment for option, I would say, for outside.
Absolutely. There's so many patients that have these chronic conditions that maybe just haven't started infusion therapy because they don't realize, or they're a little hesitant, they're afraid of the cost, they're afraid of the process. It's much easier to take a pill or even maybe a self-injectable. But we do know that infusion treatment is more efficacious. So generally, if patients are on infusions, it's going to be a higher, efficacy drug. So patients are going to have better outcomes. So really what I would say is when a patient switches from a different infusion center to our center, they enjoy coming to us. They stick to their appointments. They have better outcomes. They get to see the same provider, same nurse every time they come in. And we're doing so much more than just administering their treatment. We truly become a part of their healthcare journey. We're in touch with their provider. We can let them know if the patient has adverse reactions or side effects or anything that needs to be addressed or that may seem off. And then it also cuts down traveling to the hospital. For example, I had a patient that was traveling to Boston to get her infusion every 2 weeks. She was having to take PTO off work, find childcare. She found local infusion and she asked, she called us and said, could I come here for my treatment? It was 30 minutes from her house. She was at our center, received her treatment and back home before she would have even arrived at Boston because that was a 2-hour drive for her. So she was like, I'm getting my life back. I'm getting time back.
Little by little.
And it's a positive experience, not to mention 2 to 3 times cheaper than going to a hospital, which at the end of the day drives down cost for everyone. When a majority of these treatments are happening in a hospital, that results in higher premiums for all patients, regardless if you're even on the treatment. Okay. So going to this outpatient center, having a better experience, higher quality, lower cost for all. It's a win-win for everyone.
Nice. I like that. So I think that Ashley, you mentioned it I don't think anybody could describe it better than you why this is such a great introduction to the medicine field. Not everybody knew about it. For me, like I said, infusion was just about vitamins and in general terms, but thank you for enlightening me on all this information. Like we said before, if you want more information about what infusion is, you can go to the www.mylocalinfusion.com. You can also go to the New Haven office, 203-941-5429 if you want to get more information or make an appointment, right?
Absolutely.
What else? Tell me anything that you think why local infusion is so special, or anything that you think that people should know in general. About infusion, anything else that we have been missing, something that you think it might be relevant or important to let them know. Now I want to know more about infusion. I was going to be directly, once we're done
I'd love for you to come and see one of our centers.
Yes.
So I think, local infusion is special because we have designed the entire model with the patient in mind. The outpatient infusion industry has kind of been overlooked over years. It's not been something that has had an extremely high bar, high standard. And we've put everything into the model, everything that I saw as a nurse, working in a neurology practice, what the patients were missing, we've put that into our model. We have 98 out of 100 satisfaction scores from our patients. Almost every one of them says, I want to come back, I wish I could come every day, which is not something that typically happens when you're getting a medical procedure done.
Yes.
And then, just when you look at our center, when you see our center, you'll understand the difference. They're beautiful centers. We have skilled nurses. Our IV stick rate is just about on average 1. So we're really not sticking patients more than 1 or 2 times when they come in, which is something that I strive for personally. And we want to make it easy for you. So if any of you that are watching, if you have a chronic condition, rheumatoid arthritis, osteoporosis, high cholesterol, thyroid eye disease, there's so many diseases that are treated by infusion therapies right now. If you talk to your doctor and you're prescribed one of these and you have a question or you want to come to local infusion but you just don't know how to get started, I encourage you to advocate for yourself, tell your patient or your provider, I've decided I want to go to this local infusion because I'll have a better experience and it's 2 to 3 times cheaper. Just pick up the phone, call or text us, and we'll do the heavy lifting for you. We'll obtain the order. We'll do all the insurance work.
Oh, perfect. Ashley just said it. If you know anybody, if you're passing through any of these conditions, talk to your local doctor. Get information about infusions. Stop by Leeds Health Fair on July 17. We're going to have more information about infusions, what it is. And if you want more information, stop by, go to the website, give them a call. So far you can save a lot of time based on what I hear. If you know anybody, this is very important. If you know anybody that's going through, any of the topics that we have been talking about, saving time, feeling comfortable, having a space created just for you, give them a call to your local infusion, 203-941-5429. And if you want more information, go to their website, www.mylocalinfusion.com. Ashley Knapp was here. She will be here on July 17 on the Danbury Health Fair. Stop by. You cannot miss it. Ashley, anything else that you want to add up?
I think the only other thing I forgot to mention, which is one of our patients love this, we also offer night and weekend appointments. Oh. So that doesn't happen at the hospital.
Hold on. Rewind.
I really should have added that sooner. I can't stress enough what we're trying to do is really make this seamless for patients and enjoyable as much as possible. They shouldn't have to take off work to get their infusion treatment. So we offer those extended evening hours and weekend hours so that it's flexible for patients to come in.
So your local infusion is making a big difference in your community. You can save time. You can actually go around your clock and make this work for you or anybody that you know is taking care of yourself, taking control of your body and helping yourself. So if you want more information, stop by 358 Main Street on July 17th. We're going to have more information about your local infusion. Ashley, thank you very much. I really appreciate you being here.
Thank you.
Again, the number to get in touch at the New Haven office will be 203-941-5429 if you want to get more information or make your local appointment. And if you want to get more information about your local infusion, go to your website, go to their website, mylocalinfusion.com. And from there on, you will get all the information required. This is very important. Thank you for watching. We really appreciate all the information that you have provided us. And you already make a commitment to come around next time when you start out working with, and when you start working with Husky in general. Here in Connecticut. We look forward to see you here. Thank you for coming.
Thank you for having me.
It's been a pleasure. This has been your educational in health podcast here offered for you, at least. Thank you for watching, and we'll see you later.
Thank you.